Joining me today on Startup Report is the founder and CEO of Constellation for Health, Saru Seshadri. Welcome, sir.
Thank you, Joe.
So your company, I use the tiger analogy, emerged from the forest like a tiger ready to pounce. That's a successful company, kind of in stealth mode. It's congratulations on coming out to the world.
Yeah, thank you so much. It's been a good exposure to get started in a stealth mode and then reveal it once we got a little bit foundation done. So yeah, that's been good.
Takes the stress off.
Yeah, absolutely.
So Constellation for Health is an ambitious company. You're doing a lot of different things in the healthcare space. Can you give us an overview of the company, and then we'll dig a little bit further in?
Yeah, I mean, I had a unique perspective working with U.S. healthcare and outside of U.S. as well in healthcare. First, as myself personally experiencing healthcare, taking care of my family, and then secondly, as an employer providing healthcare benefits in the U.S., and thirdly, as a solution provider, as a technologist to the healthcare industry in the last 2+ decades. Then when I had this opportunity to kind of sit back and see, what do I want to do next, looked at all the challenges in healthcare, the concept of Constellation 4 emerged, and we started attacking some specific systemic friction points that I've seen in my experience from all these perspectives. And that's what Constellation 4 is about, and that's how we got started. And then when we got started, we didn't want to kind of reveal this as another startup and start taking a look at funding and things like that. We wanted to get some foundation established, and that's what we did over the last year and a half. And with COVID, the timeline got stretched a little bit, but I think it worked out in the best out of this year and a half. So.
Makes sense. So let's dig in a couple of those friction points. So what were some of those that you saw immediately, and what were your solutions for them?
Yeah, I mean, typically when you look at U.S. healthcare insurance, we're in a third-party payer system model where insurance company pays for your services, and then you go to a doctor, a physician, a hospital, whatever the care that you get, part of the payment comes from a third-party insurance company, regardless of whether you're insured through Medicare, Medicaid, or a commercial insurance. So that then sets up an ecosystem of patients, payers, and providers. Payers are the insurance companies, and providers are the folks that provide care to the patient. What happens behind the scenes between the payer and provider, we don't normally experience as a patient, except for the actual care that we get and the coverage that we get. There's a lot of things that happens between the payers and providers for them to actually accept your insurance plan and give the care that you're getting. So that leads to the number of things that they have to do and the number of friction points that exist today, starting with just the basic relationship management between how the payers and providers strike a contract between them. And then once they've contracted, how do they provide service to the members? So lots of complexities. If you look at it from the doctor's perspective, they're dealing with a number of insurance companies at the same time to address the population that they're serving. If you look at from a payer perspective, they have to get all the providers into their network that their members need care for, right? So that then creates a complex system of things that need to happen to make that relationship work. So then you start digging into the regulations behind it, the rules behind it, the business models behind it, and the workflows and the systems and the data. There's just numerous friction points that is happening today. So.
Yeah, and one of the hallmarks of startups in medicine, essentially, is not so much the friction points are there, and a lot of times the solutions are there as well, but the adoption is the challenge, because you have to, even in the example we use, there's so many different players that have to opt in to make the platform work. So how are you attacking that problem? Are you trying to piecemeal get adoption for specific things and then connect them together, or what's been your strategy for getting adoption?
Yeah, great question. So in fact, we have to temper the vision in such a way that you don't talk pie in the sky ideas, because then adoption becomes a big challenge. At the same time, you look for specific, what I call as inflection points, that have to drive a change in the behavior, right? So if you marry the compelling events around the inflection points an inspiration of certain other examples that they can relate to. And thirdly, if you look at the motivations behind how a particular system works today versus what it should work tomorrow, if you combine all those three things, and then look for specific conversations that you can have with the stakeholders as an entry point, then the solution starts emerging. But as a startup, what we have to look at is what are those right conversations to have while having a blueprint towards that vision, right? So that's where the execution of a startup becomes challenging, because you get certain unique opportunities to leverage certain things. At the same time, if you start going down a track without that vision and blueprint for you, it becomes challenging to come back and execute against the blueprint. So that's why it took us about a year and a half to map out all these things, look at the market fit for what we are trying to do, what are the conversations that people are having today, what are the compelling thoughts in their head to act today versus tomorrow, and how do we build up that momentum towards that final end state is what we're looking at. So I consider myself in a journey to provide these solutions as opposed to just showing up with one solution and say, ta-da, right? So that doesn't work in healthcare.
Sure. And when you have those conversations, as you've come through this sort of, getting to know what the right path is, do you feel the conversations start with the providers first or with the payers first, or do you have to actually do them at the same time?
Again, a fantastic question, because like I said, in my original context of looking at it from multiple perspectives, one of the challenges I saw that causes this friction is the solution provider usually has been providing solutions from only one lens or only one perspective. So when we started looking at these, the fundamental theses behind this, we wanted to make sure that all three stakeholders, the patients, the providers, and the payers, we look at that the solution from all three lenses. So we have been talking simultaneously to both providers and payers because we're solving the friction between them while keeping the patient experience in mind. So we're having discussions on both sides, which is what the uniqueness of Constellation 4 is. And then when we start connecting the dots between them, then there is an aha moment. Then they say, okay, now I can see where you're connecting the dots and how you're driving value for both. And that's what is making C4, Constellation 4 very unique.
That makes a lot of sense. And so as you're able to inject these specific solutions that ultimately form the Constellation.
Yeah.
A little light bulb with the name just came on. Are those things that you can inject into existing technology? Is the idea that you're trying to, force as little replacement technology or replacement behavior as possible?
It's a build up towards the final replacement because we have to be cognizant about all the existing investments that have been made and the existing systems and the existing workflows. So the way we looked at the frictions, what are the root causes of the friction is the first question we asked. So what we started off with was one of the root causes is actually the data and the data quality, right? So I'm pretty famous for this quote now where I say the shirt and the jacket that I'm wearing has better data quality throughout the value chain of manufacturing through retail to e-commerce to consumer than the doctor's information in healthcare systems. So we looked at that as one core problem of how do we address the data quality issues. But then you can't just attack the data quality and providing clean data. You also have to look at the processes that cause bad data quality as well. So that's the starting point of the conversation we have. And then once you start looking at that and looking at the existing systems and help improve the data quality issues, then the natural progression is what is the relationship that we can drive better with better data. So we could enter the conversation from relationship perspective or data perspective or data analytics or experience perspective. So those are three points at which we start these discussions, and whichever one is the most apt thing for that particular customer, for that particular situation, we're able to lead with our solution.
Right. And, when you use the example of the supply chain in, garment manufacturing versus we'll call it the supply chain of data in the medical field, there's one sort of distinct difference in that in clothing, there's clearly aligned interests, but in medicine, you actually have conflicting interests at some points, which, dirty data is one thing. When you go back to the source of the data, it may be that there's an incentive to make data go one way from the provider and another incentive to make data go, because they're basically, that's where the money piece of it comes in. So, is that a apparent problem in how you check it?
It's a huge problem, actually. So there is a what I say is there's a natural tension between the payers and the providers, because the payers want to deliver good care at an optimal cost. The providers also want to give good care at an optimal cost. So there's a natural tension between them. So that's the uniqueness that I think we're bringing in Constellation for. How can the payer treat this network as a value chain, just like a manufacturer and a retailer would do, and also bring in some of the best practices of those types of things into this network. At the same time, make sure that we're protecting the healthcare interest, and at the end of the day, patient is not a consumer, right? Patient needs to get well. But fortunately for us, the industry is also changing in its thought process in what's called as the volume to value play. So the transition is happening from multiple perspectives. One, from a compliance perspective, at the same time increasing the patient wellness. So instead of treating the sick and becoming sick care, we want to keep the patients healthy, is a motivation that's a common motivation now. So we leverage the volume to value play, because now there's better discussions to have. So the provider wants to keep the patient healthy because there's motivation to keep them healthy, both from finance perspective as well as care perspective. The payers want to deliver better care at an optimal cost. So they're also incenting the providers to make sure that the value is given to the patient. So that is one conversation starter that helps us kind of start the solution with, hey, how do you deliver value-based care? How do you deliver value-based care with a good network? How good is your network? So now those things become compelling conversation starters for us.
That's great. And I said it's an ambitious project that you have your head around it quite well. So that's great. And as a startup, love to hear your experience. You've got quite a team. You've got some big power players here locally. The legend Suhas Apti and Rich Haruska. So how's it been building a company from scratch?
Yeah, it's an interesting evolution even in myself to get started this way. My first company, I started with a one-man bootstrap company and had a lot of battle scars, and what not to do was a big thing when I started this venture. So one obvious thing is that leveraging the Tampa Bay ecosystem, and unfortunately for us in the last 3 to 5 years, the ecosystem has actually emerged as a very powerful ecosystem. And my experience is working with the ecosystem as a volunteer in growing the ecosystem, as well as operating as a CEO for FIBA, Florida Israel Business Accelerator, getting exposed to the Israeli startups, as well as working with the local entrepreneurs. It's given me a lot of experience in the team is the most important thing. It's not the mission, but also the mission is important, right? So I started reaching out to local folks as we started building the stuff. I had some early joiners with me who had worked with me in past projects. We started that foundation. Then I'm a member of the Industry Entrepreneurs Thai Tampa Bay chapter. That's when I met Suhas. Suhas and I built a good working relationship. I was a co-chair for the Thai Angel Fund. And in that process, I got to know Suhas a little bit. He's a personal mentor and advisor, not just a business partner in this venture. And then through Thai, I also met Rich and got to know Rich a little bit in close quarters. We had collaborated a little bit between FIBA and Tampa Bay Wave, and we were both colleagues at in that project. So Rich and I had built a good relationship. So that then formed a good partnership for us to get started in Constellation 4. So Rich started in September. Again, we kept that news a little bit under the covers while he was getting going with what the mission is about and putting all the foundation stuff together. In the meantime, we were also delivering significant product to our customers. So that helped us form a foundation. So Rich and Suhas, I have to thank them greatly for getting us to this point and then getting a launching pad set up for the growth in the next few years.
That's wonderful. So speaking of the next few years, let's finish up by talking about the year ahead. So what's success look like for you in the coming year?
So this year is a good build year for us. While we built a good foundation, we need to get our products aligned for market fit further. We've established a partnership with Salesforce. Salesforce Health Cloud is a good platform for us to build our future solutions. We've also worked on some cool things to bring key solutions to the market. One is called Provider Network Management. This is what the payers use to build the network and manage the network. But then as an intersection, we see referral coordination between primary care physicians and optometrists and ophthalmologists and specialists as an opportunity to reimagine this relationship as well. So powered by the same platform, powered by the same data platform that we've built, we're reimagining this whole provider network management and what's called as referral care coordination between physicians as the two big pillars of our solutions. So over the next 18 months or so, we are going to be putting together specific sets of capabilities for building complex solutions in these spaces. So that's what is going to fuel our growth, as well as get our products launched into the market, and hopefully working with some very good players, both in the local ecosystem as well as outside Tampa Bay as customers and partners as well.
That's wonderful. Really enjoyed hearing about the company. Congratulations again. I will tell you that Rich loves to work. He likes 60 to 80 hours a week, so don't be afraid to pile it on.
Yeah. So we have a strong team, which is a great addition. The other guys are also awesome, and I'm looking forward to taking Constellation 4 to the next level and mapping new constellations, essentially.
Wonderful. Saru, thank you for coming in so much. Really appreciate it.
Thank you so much.